What was the idea of pain bus which traveled through Austria?
We felt that a lot of people did underestimate their problems. And we found out that we have no real idea how many people of the Austrian population are suffering on pain. Primarily, we thought that we have to estimate about 300,000 if you take in your mind that Austria has around 8 million inhabitants. Now then, we realized that we have at least to calculate with 800,000 people. And then we found out, after having done this calculation, that at least 200,000 of the population are not or under treated. Now, we couldn't find out how to do this. And then we thought if patients do not come to us, we have to come to them. And they experience, or let's say, similar things were made by collecting blood. They are blood buses. They are collecting, if there is anywhere a ferry or something like that, the Red Cross goes there with the bus and they collect blood. And then we thought, okay, if there's somewhere a ferry for, we have ferries for geriatric people, then they are offered to go to some nice places, to spas and other things. We deposited, positioned there the bus, and it's a huge bus with two parts, and there were sitting 3 doctors, a rheumatologist, an osteologist, and an anesthesiologist, and then we did interviews. And we found out that more than 70% of the patients who came to us had never seen a doctor before because of their pain. For other things, yes, but not because of their pain. And the overwhelming majority were patients suffering on joint problems and even rheumatic arthritis.
But what in general the prevalence of rheumatic diseases, osteoarthritis among pain syndromes?
Yes. So the most was polyarthritis, and then the other part is low back pain. So this is degenerative. And we have to take in our minds that at the moment 66% of the population who goes to early retirement because of disease is related to either bone problem or joint problems. That's about 30%, and the other is depression. And we know that these chronic pain and depression is something which is connected, at least in 30% of the patients. So we have to face these problems in order to get the people back to work, because that starts already with 50 years, and this is quite a lot of money, which goes then into the early retirement pension instead of putting the people back to work.
Well, so what is the treatment of choice today against pain in osteoarthritis?
The treatment of choice is, of course, taking non-steroidal inflammatories.
What drugs would you?
We would recommend short drugs with a short elimination half-life, because we know all that acidic drugs will always go to the inflammatory sites and stay there much longer than in the serum. So in order to avoid side effects like gastrointestinal disorders and to avoid side effects like interference with blood pressure drugs and to avoid interference with the kidney function and even in liver function, because a lot of these drugs in some patients will induce pathologic liver enzymes. So the lower the serum level is, the better it is for the patient, and we have always to look how long these drugs stay in the inflamed tissue. And you will see that most of the drugs which we are using are staying at the inflamed tissue at least 12 hours.
So what is the mode of administration, twice or 3 times per day?
I would recommend, as to this consideration, to give the drugs twice daily and not 3 times daily, in order to give the kidney a chance to relax.
And what is most popular medicine you use from NP?
At the moment, the most popular drug in Austria is diclofenac and lonoxicam. Diclofenac has an elimination half-life of 1.5 hours, and lonoxicam has an elimination half-life of 2 hours. And the point is that according to their interference with COX-1 and 2, these both drugs are very specific, and you need the lowest amount. The most potent blocker is lonoxicam, and the second potent blocker is diclofenac. And the interesting fact is that we recommend 8 milligrams twice daily of lonoxicam, and it is supposed to be 3 times stronger than diclofenac. But if you look at the clinically recommended dose, diclofenac is recommended with 50 milligrams, or twice daily 75 milligrams. So this is more than the double in relation to lonoxicam. So and therefore we see less side effects with lonoxicam.
Is Zoldyar recommended in?
Zoldyar is of course recommended. Zoldyar is a combination of paracetamol and tramadol, and we know that both drugs have a synergetic effect on analgesia. However, as to our experience, the dosages at the moment are too low. I would rather recommend to take 2 tablets instead of 1. Then you may have an effect. And the advantage of this combination is that you can it always combine with a non-steroidal drug. So then you have 3 drugs acting together, and all 3 will develop a synergism. So you can save dosage and increase the effect.
Do you use Versatis in osteoarthritis?
What's the free name?
Versatis lidocaine patch.
Yes, we do, but only in low back pain, and only then if we believe that the low back pain is due to, let's say, iliosacral joint overload or to facet joint, because you cannot go deeper. It's only then for relaxation of the muscle.
Right. What are the non-pharmacological approaches in treatment of arthritis?
Osteoarthritis, the main approach is always physical therapy. However, the point is that the physical therapy is very limited in Austria. You know that if you do physical therapy, you have to have at least 20 sessions in order to get an effect. But just at the moment, the insurance will only refund 6 sessions. So that makes no sense, because this is then rather doing nothing. So, and we all know that exercise and medical observation is the best. So but that's not only for osteoarthritis, this is also for osteoporosis. We need to teach our people who are sitting more and more in the cars and sitting in front of the television, instead moving themselves. We need to teach them how to exercise a certain amount of time in their houses, and also how to do their homework. A lot of people do not. They lift weights wrong. If they work with ironing, they are mostly standing in a bad position instead of sitting down and relax their backbones. So I think we need to do a lot of public work besides medication and besides medical physiotherapy, but also to bring people back to normal movement.
And last question is, why in the prevalence females dominate?
At the moment we have the population in Austria is that we may expect a life experience of males of 79 and the females of 84 years. And that makes the difference. And the point is that due to diets and due to, let's say, the change in the average work. Males are not so exposed than you used to, because let's say 2 decades ago they did a lot of physical work, but at the moment this is all performed by machines, and hence they are not so exposed than they used to. Now the difference is now the age. So the older people become, the higher will be the prevalence of degenerative diseases, and therefore, at least to our own statistics, we got more females with osteoarthrosis than males. And besides, this is accentuated by the fact that females have more often osteoporosis, and they have a combination of both diseases. And there's the prevalence a lot higher in osteoporosis than in males.
Right. And just to summarize, could you please name first 3 medical approaches to treat osteoarthritis? Just name.
Yes, as to the recommendation of the rheumatological associations, the first choice, because of the least side effects, is paracetamol. But we have to face that it is not specific. The specific treatment starts with anti-rheumatic drugs like the non-steroidals, and they will act directly in the inflamed joint. They will depress the inflammation. In that case, they will force the perfusion. And so we may expect that they do not only decrease the pain, but they will also improve the movement and the recreation of the joints. So this is, let's say, a specific treatment. Okay, and then there are disease-modifying drugs also, and I would say, although the evidence is not very convincing, we have quite a good result in giving them systemically or even in injecting them into the joint. And at least in a third of the patients, we may expect quite an improvement of their performance. And then
could you please name some of his
hyaluronic acid is this mainly.
And sulfanilamide?
Sulfanilamide is also given, but that is mainly performed by the rheumatologist. So I personally do not have a big experience with this drug. I know that it's
but
given,
they both act,
and we may expect reactions, and they should be given as early as possible. So then you can let's say, at least delay the progress of the disease. So I would say this is certainly a sort of treatment which is underestimated. Mm-hmm. And then, of course, opioids are always indicated if pain interferes with the physical training, because the first choice is always physical training, and if you have pain, you cannot make physical training. So therefore, opioids are indicated in osteoarthritis as well, because as it is in other chronic diseases.
Right. And you personally, do you do physical trainings? Going
yes.
For sport?
Yes, yes.
I
only have a problem. I got polymyalgia rheumatica now the second year. Right. So I used to play until 2 years ago every Sunday ice hockey, and I'm going as often as I can 3 kilometers to my workplace. So only if I'm under time pressure, then I take the car.
Right.
So that is other people go jogging and I go walking. That's what I do.
Thank you very much. Wish you
a pleasure.
Good activity. Thank you.
Thank you. Goodbye.